I'm Matthew Ippolito, an assistant professor here at Johns Hopkins. Welcome to the third and last portion of our program. We will hear from our final keynote speaker and from the two remaining Sub-Saharan Africa ICEMRs, followed by the lightning talk poster session. To begin, it is my pleasure and honor to introduce Dr. Rick Steketee, the Deputy U.S. Global Malaria Coordinator for the U.S. President's Malaria Initiative. A medical epidemiologist by training, Dr. Steketee brings over 30 years of public health experience to the malaria arena, having previously served as the CDC Malaria Branch Chief and the Director of past Malaria Control and Elimination Program. The title of his lecture today is Malaria Science and Program, Challenging Topics of Climate and Localization. Thank you, Doctor, for joining us at this year's World Malaria Day Symposium, and the floor is now yours.
I'd like to begin by thanking the organizers for inviting me to join you today. The discussion has been today all about malaria in Africa and the connection between our science and our policy and program. And what I thought I'd do today is turn that upside down a little bit and point out that we do have some policies that affect our programs and also affect our science in terms of our choice of what we do with our science and how we do it. And so that's an area that I'd like to just bring our attention to. I do want to thank the many people who have contributed to this. And with that, I'll just bring some context to this. So in the global context, we all know that as we're viewing this webinar in virtual mode, COVID has been a real part of our life for the last couple of years. And climate change has been a longstanding part of our life and something that we're increasingly paying attention to, which is good news. Unfortunately, conflict has found us in the middle of this, a scene from Ukraine here to put that on front and center. And in the midst of this, we're looking at a global technical strategy for malaria, which was devised in around 2015, published for 2016 through 2030, and updated recently in 2021. That has been caught by the fact that in this World Malaria Report 2021 slide, malaria mortality estimates showed an initial drop in the blue line early on that was really heartening. And we wanted to continue that in this dashed green line, but found ourselves flatlining. And it's going to be a lot of work even to get what we see here in the dashed blue lines. Given that, as was mentioned earlier, we also still have new tools coming forward, not just one, but hopefully many more. And that should give us some heart in this struggle. There's an African context here as well. One of those is around urbanization, huge issue on the continent where populations are increasingly coming together. At the same time, we've got rural areas that are dealing with weather events, some of which are either more frequent or more serious. And we have threats like Anopheles stevensii coming from Southeast Asia or Asia and moving across into the Horn of Africa, able to take those urban environments and potentially propagate transmission in places we haven't seen so much before. And with conflict, unfortunately, Sub-Saharan Africa is experiencing a substantial amount of conflict, shown here in the red or in the orange for protracted challenges for governments. And then finally, in the effort for universal health care, the efficacy of effective coverage shown in the red and orange is at its lowest rates in Sub-Saharan Africa, where we're trying to do the battle against malaria. So in the midst of all of that, PMI updated its strategy this past year and published it. And I just wanted to highlight a couple of things. That is, we held on to the three objectives of decreasing morbidity and mortality and pushing towards elimination where we could. while we're holding on to objectives for yet another 5 years, there is a more targeted effort in the midst of that. In addition, we introduced 5 focus areas. This is not all that we do by any means, but it is paying attention to reaching the unreached populations, to strengthening the community health systems that can do that, to keep malaria services resilient in the midst of COVID and of conflict and climate change, and then to invest locally, and finally to innovate and lead. And perhaps the innovation and leading is some of where we're putting our resources that relate to the science. That said, there's a lot of work going on in terms of measuring and documenting how we're doing on the other 4. President's Malaria Initiative, as people realize, began in 2006 with $30 million and 3 countries. We added countries as partners progressively over the years, such that now we're working collaboratively with 24 countries in sub-Saharan Africa and 3 countries in the greater Mekong subregion, a total of 27 countries. And at this point in time, we have an annual budget of $755 million. What that means is that PMI has invested approximately $8.5 billion over these 16 years in helping partner countries fight malaria and strengthen health systems. And I bring this to your attention because there's a lot of work going on the program side that is trying to pay attention to the science and what needs to be delivered. So much of those resources go to delivering, to funding and helping deliver insecticide-treated nets, indoor residual spraying, intermittent preventive treatment in pregnancy, seasonal malaria chemoprevention as our major preventive interventions, and then the use of rapid diagnostic tests and artemisinin combination therapy for the case management and the burden reduction that we can achieve. But just the numbers and the magnitude of those in terms of products delivered, this is huge, and they don't deliver themselves. So there's a lot of work in the midst of that. The consequences of all of that have been that all-cause child death rates in these countries have dropped by 43% since the beginning of President's Malaria Initiative. That's not all because of the President's Malaria Initiative by any stretch, but it's a collaborative opportunity that we do with other groups doing malaria, as well as trying to be good about the health systems that are supporting other intervention programs against other diseases. But this is a big deal. That said, we're very concerned that flatlining of the mortality rates is really troubling at this point. So that brings me to then thinking about our PMI strategy and this relationship between policy and program and science. And I wanted to address a couple of global priorities that go well beyond malaria. The first one is climate change, the second one about locally led development. So let me begin with climate change. First of all, some definitions so we're all on the same page. Climate is a long-term 30-plus year average of the weather in a given place. It's defined by average temperature and precipitation, but also by the type, frequency, duration, and intensity of the weather events. And that includes things like drought, extreme heat, floods, extreme precipitation, the hurricanes, cyclones, tornadoes, and wildfires. Weather, on the other hand, is the state of the atmosphere at a point in time and place, today or forecasted for this week. And most of the weather that affects people, agriculture, and ecosystems includes that same temperature, precipitation, humidity, clouds and sunshine, and wind. But one way of looking at this is that weather influences what clothes you wear today, while the climate influences your entire wardrobe that you choose for the place you live in. So at this juncture, climate change is a major US presidential initiative, as well as a global priority. And that means that just about every US agency is being asked to pay attention to how it's doing, what it's doing in terms of addressing climate change. That said, I would call out the fact that malaria is neither the cause of climate change, nor is malaria control the solution to climate change. However, malaria programs deal with climate and weather every day. And just to think about it from a science standpoint, does the science support a biologic link between climate change and worse malaria? Or is this primarily a malaria programming issue? Let me try to expand on that just a little bit. It's not questioning the link between the environment that we live in and the transmission of malaria and the consequences of that. It is asking the question as to whether or not our science is indeed doing exactly what it needs to do, and whether our programs are addressing the issue. And I'll come back to this in a little bit. So when we think about science, we think about publications. So this is just a quick look in PubMed, searching on climate change and malaria. And over the last 30 years, we get 684 references, and these are plotted by year of publication. So you can see that whether it was not much attention or a little bit of challenges in terms of how to do the science around climate, the first 15 years of that have not been publication replete. And by around 2007, 8, and 9, this started to increase, and then it's been a steady progression since then. The science on this is very diverse. And you can imagine that if you wanted to pick something that's going to take you 30 plus years to understand, that is climate, that's not a quick win in terms of your publication record. So it takes either historic data or it takes a lot of modeling. So many of these publications are around modeling. And only more recently do we have sufficient data over time that we can then understand in terms of disease. Let me call out 2 articles. The first one is just this past January, John Bulbus and colleagues published a perspective in New England Journal of Medicine after COP26. And the COP is this annual UN climate change conference. And we're now in the 26th year of that. And this is putting health and equity at the center of the climate movement. In particular, they speak to decarbonization of the health sector footprint, both locally and globally. And that's something that I want to call out for all of us to be thinking about as to what it is we're doing in our malaria community about decarbonizing our health sector footprint. The second publication is by Pete Gething and colleagues, some of the strongest modeling groups, I should say, in our malaria field, published in Nature in 2010, that climate change and the global malaria recession. And they caution this potential overstatement or misdirection of the climate risks for malaria. And at the end of their article, they state that predictions of an intensification of malaria in a warming world must be set against a context of a century of warming that has seen marked global declines in the disease and a substantial weakening of the global correlation between malaria endemicity and climate. Essentially, that means that our malaria interventions have been able to overcome whatever change that we've experienced to date in terms of climate change and global warming. That doesn't mean that we shouldn't be looking at these risks. It just means that we probably need to pay attention to their locale and that some aspects of this will affect us in one location, but not in another. And paying attention to the targeting of that, those concerns and the interventions to be put into place become really important. So what about weather? So weather determines our mosquito populations and the parasite development in the mosquitoes. And it actually determines the whole life cycle from egg laying to adult survival, according to water sources, temperature, humidity, and again, all in the context of the control measures that are in place locally. Just to call out weather here, that it's water, and that can be not enough, too much, just right, maybe with shade, maybe with sunlight, maybe the right temperature. Some vectors like a little bit of salt, some don't. The purity, the flowing or stagnant nature of the water, and the durability of the sites of the water so that the full larval development can occur. Temperature can be measured in terms of highs, lows, median, mean, etc., and it will vary from morning to night. And humidity is linked to the water and the temperature. And finally, the proximity of people to the water matters. And together, these drive malaria transmission and seasonality, again, in the context of our interventions. So just in case the colleagues at Johns Hopkins have been paying attention to their history in documenting the seasonality of malaria, this is a graphic from, or a table from the 6 years between 1889 and 1894, where they documented 614 cases of malaria. As you can see, most of those cases occur in that July through October interval, either for onset of illness or for admissions to the hospital. And so this has long been a seasonal disease, whether it's in North America or elsewhere. And yes, we talk about perennial transmission, but seasonality occurs even in essentially every perennial transmission site. The development of the parasite in the mosquito is absolutely temperature dependent. And this is data from the 1940s, where they looked at what happens when the temperature is held at 28 degrees centigrade. And on average, sporogony takes 7 days. That is the full development of the parasite within the mosquito. If we drop that temperature down to 16 degrees, that takes 55 days. And in fact, below 15 degrees centigrade, no species of malaria parasite can develop in the mosquito. So absolutely temperature dependent to get parasite development in the mosquito. And global warming, if it's pushing locations on average up a degree or up 2 degrees, that's a huge issue in terms of the potential for transmission going forward. In addition, temperature and mosquito development has some mixed results. So first of all, for egg laying, eggs don't get laid below 54 degrees Fahrenheit. We're talking about the same relative numbers in centigrade that we just saw on the previous line. So, but they are laid once the temperature rises above that, but hatching won't occur until temperature gets up into the high 60s and 70s. Larval development in that body of water takes a long time if the temperature is low, 30 plus days at 16 to 19 degrees centigrade. Takes half that as you move the temperature up to 20 to 22 degrees. And it takes even less as you move it up to 24 to 27 degrees centigrade. So warming gets you faster larval development. The flip side of that is that if the water source is not great and larvae end up high and dry, the survival of the larva at 20 degrees centigrade is 2 days, if you push the temperature up, it goes to 1 day, or at or above 40 degrees centigrade, it's down to 2 minutes. So larval desiccation is a problem as temperature rises. I would like to suggest that program attention to climate change does remain critical. Every one of our programs is responding to severe weather changes, the rains, the floods, et cetera. They're responding both from a transportability, from getting the right materials to locations that have been cut off, and then thinking about what goes on afterwards as the rains recede, but the water is still there. But doing malaria science and program also consumes energy and requires energy conservation. So our programs are using energy, and we do need to pay attention to that and figure out how we can conserve as much as possible. And then I'll come back to this question of, will more climate science make a difference in what we do in our malaria intervention policies and our programs? I think we have a responsibility in our science community related to climate change. The first is addressing our energy sources and our consumption that allow us to do our science. And that's whether that's in the lab, in the capital city, or out in the rural area, or back in a specialized laboratory in the United States, for example. We do need to set an example at home and support local energy infrastructure and decarbonization in the endemic settings as well. And finally, this doesn't happen by itself. You didn't necessarily in your grant get resources to put solar panels on the health facilities that you're working in order to get your electricity, in order to run your tests. And so linking financing for malaria research and for climate change is something that we all need to pay attention to. So let me move to locally led development, perhaps more briefly. Malaria scientists have been engaged around the globe. So locally led science is not a problem. This webinar has been a testimony to incredible science and really top-notch presentations of the work by people in a number of countries and in a number of locations. So it's not like we don't have a lot of scientists working with us. But let me just point out, so the USAID administrator, Samantha Power, gave a talk in November of last year, where she laid out USAID's vision for global development. And she said, if we truly want to make aid inclusive, local voices need to be at the center of everything we do. We've got to approach this work with intention and humility, and the entire development community needs to interrogate the traditional power dynamics of donor-driven development and look for ways to amplify the local voices of those who too often have been left out of the conversation. I raise this as someone who works directly with USAID and the President's Malaria Initiative. And I look at these sentences and I say, well, what if I replace in the first sentence, aid with science? If we truly want to make science inclusive, local voices need to be at the center of everything we do. And if we replace the word development in the next paragraph, with science, the entire science community needs to interrogate the traditional power dynamics of donor-driven science and look for ways to amplify the local voices. This is not a new process for USAID, nor is it a new process for the science community. The administrator's Georgetown speech happened here, but there have been launches and issue updates over the course of just about every year prior to this over the previous decade. The previous administrator to USAID developed the Journey to Self-Reliance, or J2SR, as a major policy issue for the agency. And so I'm just paying attention to this from where I sit in order to think about it from where our science community sits. So localization and locally led action as a vision and approach. Localization is a vision for more locally sustained, equitable, and inclusive development and humanitarian assistance. Again, replace development with science. It's also a mindset, behavior, and business process to shift changing our culture, our systems, and practices. You know, investing locally is part of, you'll find it as a prominent part of our PMI strategic plan. Supporting partner country governments, investing in peoples and partners closest to those we serve, and encouraging country commitment to end malaria. We've not done badly. This is not me trying to complain. The Multilateral Initiative on Malaria in 1997 launched with NIH as a major partner in the midst of that. Was an international alliance of organizations and individuals pushing for malaria research. It was focused on maximizing the impact of scientific research on malaria on the continent, promoting capacity building and facilitating collaboration and coordination. The International Centers for Excellence in Malaria Research are, again, a testimony to that continued collaboration, partnership, coordination. CDC has done work in field epidemiology training programs since 1980 and trained more than 18,000 people in 80 countries to address major health threats that have come forward during that interval. The malaria community has multiple systems in place for supporting locally led science. Still, we have to remember that there's a need to connect the initial training that anybody gets with a durable system, locally and globally, that support a full science career. Otherwise, we'll lose the best and brightest to another field, and we won't get the coordination and collaboration that we want. So I'm just calling this out as a global policy issue about locally led sustainable development and thinking about, are we doing all that we need to do, in particular for the durable systems and the full support of science careers. So lastly, let me say that linking policy and programming to how we do our malaria science, can we strive to be excellent stewards and address climate change by decreasing our carbon footprint, and further invest locally in African scientists for opportunities in skill building and subsequent support with their country health sector for full careers and continued quality science on the continent. Thank you very much.